le plus grand, si on peut le mesurer.
So I see Binazzouz and Palazzo is there. So can you tell us what you have there?
Okay. Good morning, everybody. We are in room 6. I am with my friend and big expert, Laurent from Paris, Clinique Trocadero, I think. We are discussing this case. It's a young lady, 20 years old. He have no symptom, and he was, I think, operated for hemangioma 1 year before for the brain. Now we will.
She has the HL mutation.
Yes, and he is now for US for multiple cyst because this lady have a VHL disease, as you know, which a rare disease, not so frequent. I think it is my 15 case I have seen before, some kind of 15 case. And as you know, there is multi-organ involvement, mainly brain. This lady have hemangioma and she had operation before 1 year. We have to look for kidney and we have to look for other organ involvement. And now we are discussing the pancreatic
can we see the
lesion in this case.
Endoscopy view?
Yes.
EOS view? We need the
yes,
view,
he
the
has
scope
asked for,
view,
he has
please.
for endoscopic.
Okay.
Okay, now I will come back again to the, now we are in front of the pancreas.
Before to describe, we are working with a new machine. The company,
SonoScape.
So can we see the machine if possible?
SonoScape,
yes.
And you have a console and a processor, and the scope has a 4 millimeter channel. It's a linear scope. Frequency from 6 to 9,
exactly.
Doppler and elastography and so on. So we are studying.
Can we have endoscopy or endoscopy view? They're fixing it now.
Endoscopy view. You want the endoscopy?
We are in the stomach.
No,
we are in the
stomach, and we don't want to put air.
Got it.
So you have the AUS view. Have you the AS view? The ultrasound view.
Exactly.
You got it?
Yeah. Now we can see the image, yes.
Okay, so if you have the ultrasound view, it's okay. Some figures on VHL and pancreatic involvement. So pancreatic involvement is one of the more frequent involvement, since around 80% of the patient with VHL has the pancreatic involvement. In the vast majority, the pancreatic involvement is done by serous cystadenoma.
Exactly.
During 20 years, we were thinking that it was simple cyst. In fact, it's very rarely simple cyst, and the majority of the lesions are serous cystadenoma. So, because that, you can have a lot of type of cystadenomas, serous cystadenomas, the standard type, which are microcystic, and mainly the macrocystic type, or the mixed type. You can have calcification.
Yeah. Here we have the biggest cyst. I am now in the tail. As you see, we have so many small cysts, but we have here in the tail, I will show you.
Can we show
here
me
we
the
have
pointer,
the kidney. You see? Here we have the kidney. It's the left kidney. By torquing and by advancing my scope, now I am in front of this.
So measurement.
Biggest cyst.
Okay. So
we will measure, please. What is the size of the cyst?
So what you have to know also is that like this, yes. So it's
here the
size. Where is the size?
The size I am looking for the size here. 40. Yeah. It is 40.5 almost. Yes.
So serous cystadenoma, which are not dangerous, there is no reason to operate.
So we can't hear you. So
it's only few. Sometimes, like in this lady, it's a lot. The main thing in VHL, you do not hear me?
Yeah,
Please,
we can hear you now.
auditorium?
You hear me or not?
It's okay now, we can hear you.
You don't hear. You can't hear us.
We can now, it's fine.
Yeah, we can hear you. We can hear you.
We can hear you now.
Okay.
You hear us now?
Now, yes,
Okay.
yes.
So I do the same thing. So pancreatic involvement, it's 80% of the patient with VHL. In pancreatic involvement, the vast majority is serous adenomas, cysts. These cysts are sometimes few, sometimes the entire pancreas, like this lady. However, pancreatic insufficiency is exceptional.
Exactly.
Even you do not see the parenchyma, there is parenchyma. So the serous adenoma has no risk at all. But in 20% to 30% of the patient with pancreatic involvement, you have endocrine tumors, neuroendocrine tumors. And 20% of these neuroendocrine tumors will have an evolution to malignant pancreatic endocrine tumor. So remember, 80% has involvement, 20% of these 80% have endocrine tumor, and 20 to 30%, 20% of this endocrine tumor have malignancy during the follow-up.
Laurent,
And at the end, and I stop my talk.
No,
at the end, endocrine tumors are the first cause of death during the follow-up of VHL. So you have, when you have a VHL involvement of the pancreas, you have to follow the pancreas every year or every 2 years, looking for endocrine tumors, not using a US, using MR or CT scan, because you can find this mass, this endocrine mass inside this VHL pancreas. However, last thing, all the vascular mass inside the pancreas of VHL are not endocrine, because you can have also the pseudosolid type of serous cyst adenoma, and the pseudosolid type of serous cyst adenoma look like endocrine. So when you find an endocrine lesion or suspicion of endocrine lesion inside the pancreas of VHL, you have to biopsy it under NUS and not to give the patient to the surgeon immediately for the reason that this lesion is more than 20 millimeters. Okay.
Laurent, my question is, now we have this cyst, I measure it again, it's 5 centimeters.
Yeah.
I look for some nodule inside. We don't have.
No, you do not have.
We don't have septa, but we have some, like.
Yes, it's blood.
Yes,
no, it's
maybe
blood.
it's bleeding.
Yes. Serous cyst adenoma are spontaneous bleeding. So you always have this kind of
small spots inside. So because in miscellaneous adenoma, we have this kind of content, and we are a little bit say what.
But when you have a very rare disease, which is VHL, the risk to have another rare disease, which is mucinous cyst adenoma, is very low. So of course you can have everything.
Yes.
So it's finished.
My question is, yes, if she is symptomatic with the
symptoms.
Really, generally, they don't have symptoms. They don't have exocrine insufficiency. So we will look mainly for tumor in the brain, tumor in the kidney, in adrenal gland, and also, as Laurent said, we have to look for endocrine tumor, maybe mainly malignant one.
No, we are looking for endocrine tumor, and when they are more than 20 millimeters, we catch the pancreas. But we do the biopsy before to give to the surgeon, because sometimes it's not an endocrine tumor, it's a pseudosolid serous cyst adenoma.
Exactly.
Thank you very much. So nice demonstration and discussion. Thank you. So we're going to move to the other room for 1 minute, then we will close for the break.
Je vais aller juste
so can you take us to